Next speaker session now. For those of you who joined yesterday, you'll recognize the friendly face of Dr. Sara Ahola Kohut, who's going to speak in greater depth today about self-care, mindfulness, and managing the disease and diet. Dr. Kohut is a clinical health psychologist and associate scientist with the Inflammatory Bowel Diseases Center at the Hospital for Sick Children in Toronto, and she's an assistant professor with the University of Toronto. As a psychologist, Dr. Kohut has trained and worked in hospitals, community mental health centers, school boards, and private practice, providing psychological consultation, assessment, and treatment to young people living with chronic health conditions and support for their families too. Dr. Kohut, Sara, thanks for joining us once again. Over to you.
Absolutely, thank you. So I will now again attempt to take over everyone's screens. Share that. And I think we are good.
Looks good.
Okay. Thank you everyone for just kind of spending your Sunday with us. My name is Sara, and I always like to start with saying, just full disclosure, I don't actually live with celiac disease, so I just really know that I can never really get it. But my best effort is that I work with people every week who live with celiac, and also have the opportunity to love someone who lives with celiac. I also like to start, I know we're in a virtual space and we're in a lot of different countries, cities, provinces all over the world. I'm actually in Toronto, Canada, and I feel really lucky to be able to work and play in Toronto and recognize that for thousands of years before me, this is actually the traditional land of the Huron-Wendat and Petun First Nations, the Seneca, and most recently the Mississaugas of the Credit River. And today is home to Indigenous peoples from across Turtle Island. I really encourage everyone to take a moment to really get curious about where they spend their time working and playing, because it really is such a gift. So I like to think of this as, by now, y'all have been there and done that. Like, you've had the accidental exposures, you've questioned whether to trust food made by others, you've had really well-intentioned folks doing their best to accommodate, but don't really recognize the importance of cross-contamination, or conversely, you've had to deal with folks or family members who just won't accommodate regardless. I know with Halloween just recently going by, you've had to go through celebrations that can be hard, and knowing that those fun-sized candies, they never actually have the labels on them. You've probably been hungry and left with little to no options, or conversely had the experience of packing an entire suitcase or a cooler with you of food, like that meme said with the picnic, where you got everything for you and you have enough food for a family of 4. But also being at those conferences and choosing the allergen-free option or the gluten-safe option while watching everybody else get to pick whatever it is that they feel like. And yes, I'm a psychologist and I work with people around their worries and their stress and sadness, but I'm also not going to try to convince you not to be bothered by these things, because it's annoying. It's frustrating. Like, that is just, it is what it is. And I think my invitation is to see how can we work with it and find an approach that's workable for you. Because at the end of the day, just legitimately, this is hard. Full stop. It's hard, but also know that you're not alone in hard. And I really love that this keeps track of participants, because I can say there's over 400 people who are doing hard with you. So the question really ends up being is, okay, this is hard. I'm not in alone, but I'm not the only one that feels this way. How can I actually take care of myself given what's going on? Not necessarily to fix hard or to get rid of it, but because it's hard and because you're doing something that quite honestly requires more on your mental load. I started with this slide yesterday as well, so I apologize for those who this might be a repetition, but I think it's worth really considering that in the way that our brains are wired, it's really to survive and to socialize. So our default state is safety. So if you are not happy all the time, there's nothing wrong with you. It's your brain's craving safety. And by living with celiac, you're probably interacting more often with medical teams, labels, restaurants, thinking about gluten exposure or cross-contamination, and these are perceived by our brain as threats to safety. And this is all in the context of a global pandemic where, again, we're watching number tickers on the news all the time about how many cases, how many deaths, people wearing masks. I think those are all things that are perceived as threats to safety. And also, humans were never meant to be alone. We were never meant to survive alone. We were really meant to find our tribe, find our people, and stick together. So between COVID restrictions and just dietary restrictions and all the socially awkward things that just come along with having to advocate for those accommodations can really be difficult and can be isolating. Which to me makes being aware of like where you're at really important and taking care of yourself that much more important because you do have a heavier load. And how do we make sure that you're making decisions that are aligned with the type of human you want to be, despite the hard stuff? So I talk a lot about mindfulness, and I know mindfulness is one of those words that most of us have heard about, and lots of institutions and schools really have these sort of like mindful minutes and things like that where you can check in with yourself. I also know that people will say meditating is wonderful, and it is. Meditating for 30 minutes a day, really great, like functionally, structurally for your brain. It's awesome. I also recognize that it's not realistic for many of us. So I like to think about how to use mindfulness in terms of leveling up everyday life so that it works for you and that you're living in a way that is aligned with who you want to be. Now, when I think about the definitions of mindfulness, two of them come up for me. One is from the UK All Parliamentary Report, because I figure if politicians can agree, then we might be onto something. And that's that mindfulness means paying attention to what's happening in the present moment, in the mind, body, and external environment with an attitude of curiosity and kindness. So really checking in with ourselves and our surroundings and being curious. I think sometimes being nice to ourselves, or truthfully being nice to other people, can be hard, and I think that's okay. If kindness and being self-compassionate is hard, you can start with curiosity. I also really love this quote from Jon Kabat-Zinn, who wrote the seminal paper on mindfulness-based stress reduction, and he said, in Asian languages, the word for mind and the word for heart are the same. So if you're not hearing mindfulness in some deep way as heartfulness, you're not really understanding it. Compassion and kindness towards oneself are intrinsically woven into it. You could think of mindfulness as a wise and affectionate attention. But here's the thing. Most people, I think, or maybe not most, but some have probably seen this image where it's kind of put out there that we should be like the dog and just empty our minds and notice and pay attention. But mindfulness isn't necessarily about that. It's not about suspending judgment, because like humans, we be judgy. We are really judgy. And when we're stressed out, we get even more judgy, because that's how we're built to survive, to make quick judgments, because we're thinking about safety. We got to get away, or we got to fight, or we got to figure out how best to survive. So we get really judgy. So if I could adapt this picture in any way, I would say, okay, so can we be kind when we pause and recognize how judgy we are and not get judgmental over how judgmental we are, and give ourselves some grace and some space? Because oftentimes when you pause and you check in, you realize how busy your brain actually is. So again, why mindfulness and compassion? And why do I think, especially in this phase where y'all have been living this for a long time, and this is the sick and tired of being sick and tired part. And I think the best way to do this is to really recognize not only the mindfulness piece, but the compassion piece as well, because folks talk a lot about mindfulness as being focused attention. or open awareness of what's going on. But I think that kind intent and that curious approach is really key. So with mindfulness, this is what it can help. It allows you, or perhaps you can allow yourself to just do one thing at a time. Society has told us that multitasking is this great thing, but we're not actually able to multitask. What we're doing is we're switching really quickly. And by allowing ourselves to focus on one thing at a time, it offers emotional stabilization and also allows us to figure out, what do I actually need right now? So it's about noticing your experience. But then you have compassion, which is taking care of what you find out. Because sometimes what you find out is not easy. The other piece of compassion to me is that oftentimes we're talking about the stress response system. We're talking about how to get rid of stress. We're not talking about the relaxation response system or the soothing response system, which also exist. So by being compassionate and having that kind and curious attitude towards ourselves and others, it does actually activate that system. It allows us to connect with other people. And research and my personal and professional experience has shown that it leads to more resilience. It's not self-indulgent. It's not selfish. It actually leads to more resilience. So you have mindfulness on the one side, which is noticing, okay, what is it that's going on right now and what do I need? And then compassion, which is like, okay, how do I take care of this? Whether it's something small or what you noticed was a hot mess. You need both to come together to be able to really think about how you want to show up and what you want to do. So the way that I think about it in terms of if you're more linear is thinking like, okay, so in your everyday lives, there's a certain amount of uncertainty and also a certain amount of a threat because gluten's everywhere. Most people don't think about gluten exposure and cross-contamination. So the invitation is to pause, to stop, to bring some of that checking in with yourself and thinking how you can take care of yourself. And what that does is that takes our brain out of that stress response and allows us to think more creatively. It allows us to problem solve, and it allows us to better care for ourselves. And this is the thing. I want you guys to think about this. So how much of your time and energy is spent either fighting against having to manage gluten exposure, or just being irritated by it, or just kind of like sick and tired, and you're kind of stewing in it, versus focusing some of that energy towards showing up as the human you want to be or doing whatever it is that you want to do. So instead of waiting not to be afraid to do something, being afraid and doing it anyway because it's important to you. Because sometimes I also think that you need to feel the feelings. Because as I said, I'm not going to try to convince you not to be bothered. It's about, okay, if I check in with myself and I realize that I'm just really frustrated right now and I'm so done, I think thinking about what would be most workable for you in that moment. Maybe in that moment, you need to zone out on a smartphone, or you need to listen to a podcast or do something funny. Maybe you need to ugly cry. Maybe you just really need to be sad and allow yourself to feel sad. Maybe what you need is to be alone, or maybe what you need is to be around other people who are supportive. This is the hard part. There is no one answer. If I could have come up with exactly what to do, I would have told you guys in the first minute and then just ended the talk and had a group conversation. But often the answer is it depends. And in order to figure out what you need, I think it's this piece of like checking in with ourselves and finding that balance between not ignoring the fact that you have celiac disease, but also not being so hyper focused on it that you're not doing the other piece. You're putting some of that energy, towards the stuff that you really love. So I asked this yesterday, and I want to ask it again because it's a question I really like asking all humans. because I'm inherently curious. That's why I'm a psychologist. But I also find it just a helpful thing to think about is, what would you be doing if you weren't worried about gluten exposure or cross-contamination? I want to really give you a moment to think about that. Now, once you have that in your mind, what small, medium, baby steps would you be willing to take to move towards acting on that? Because it matters to you, because it's important, and also you know you're going to have to take your worries and your fears about gluten exposure with you. And that's okay. Not that it's going to be easy, but that it's going to be worth it, and it's going to be worth doing. As I say this, I always feel like, I'm like, oh, well, that just sounds so simple and easy. But please don't mistake, it's not easy. I think this is a practice and something that over time you can get better at, but it is not always easy to do. So I do like to think about it more broadly, because you are not celiac disease. There's a lot more to all of you than celiac disease. So it's about thinking about when you're trying to get away from, whether it's stress, anxiety, sadness, or something else. Can you let go of some of that effort to get rid of those things? And that with that energy that you're saving by letting it go a bit, what could you put that towards, or what would you want to put that towards? Maybe it's what fills you up as a human, whether it's being outside or with people or reading a book, or I don't know, going to circus school. There's no right or wrong here. It's about what really and truly brings you joy. Or maybe even an invitation in those moments, like with mindfulness, yes, meditating for half an hour a day would be lovely. But what about leveling up something you're already doing and allowing yourself to do it? If you're brushing your teeth, brush your teeth with a toothpaste that you really enjoy the taste of, and allow yourself to savor that experience. Whether it's noticing the weight of the toothbrush in your hand, or the taste, or the foaminess or lack thereof in your mouth, instead of already being on your second or third meeting of the day, or instead of already being in your car or setting up for your home office. I think we spend so much of our lives 10 steps ahead. It's really an invitation to kind of come back to here and now and allow yourself that space to do that. So another way of thinking about it is, what's going right? We're often thinking about like, what's going wrong and what are we going to fix? How are we going to fix this or get rid of this? What if what's going right? What if our energy was like, let's like amp up the joy a bit and let some of that suffering be there, so that it's an and both, not either or. And that can be, as I just said, savoring everyday moments, even if it's brushing your teeth. For me, it's my morning coffee. I love coffee, like it's my favorite beverage. So I really allow myself, if I don't have 5 minutes to drink my coffee slowly, it might literally be those first couple sips. It's also about remembering, since our brains are wired to survive, our brains are going to be on the lookout for threats. So in order to work with that, it can be really helpful to notice what you're thankful for, or notice those little things that make you smile. This is not about toxic positivity and like silver lining everything, because that is definitely not helpful. It's more about the and both. Can I feel bloated and also enjoy a conversation with a friend at the same time? Or can I feel nauseous, but also notice that my hands feel okay, or my feet feel okay, or I don't have a headache? And I showed this slide yesterday, but I do want to show it as well today, because I think it's important to repeat this. By now, you guys have had to already advocate and had some successes and had some less than successful moments, whether that's how you advocated or truthfully how it was received, because there are some people, no matter what you say, you will not change. And just really and truly, like, you are not a burden. You do not need to apologize, really. For many, especially with your family and friends, accommodating you is an act of love. So actually being able to do that for someone is a way of showing how much you care. And that's really powerful and beautiful for the person doing it. So please don't take that away from them in some ways, if that helps work with those feelings or thoughts about whether you're a burden or not. I also want to emphasize that taking sick days is okay. It is okay to take care of yourself. You're not lesser if you are not as productive as someone else, or if you are taking time for yourself, or you're working on work-life balance. I think in society we think about like the busier you are, the more successful you are, or being busy. Like I just don't get it. I think it's not healthy for any of us. And boundaries really and truly are about self-care. And compassion isn't always warm and fuzzy and bubble baths and a book. Sometimes compassion is about being fierce, having those boundaries, being firm and gentle at the same time. And you don't have to get it right all the time. This is just your effort, your intention is enough. I like to think about it also as finding peace amongst the chaos, and like, make no mistakes, like it's all chaos, right? But you can find those moments of joy, those moments of happiness alongside, so that you're coexisting with the hard stuff and the fun stuff. And sometimes the hard stuff is fun and vice versa. So really taking care of yourself and thinking about taking care of yourself physically, socially, and emotionally or mentally. So whether that's eating, again, this is the answer is it depends, which is why there's so many options here, because what's going to be workable for one person isn't going to be workable for another. And coming back to that mindfulness piece, this is where checking in throughout the day and literally like pausing and checking in with yourself. It's the quality of my mind, my feelings, and my body. And doing that throughout the day can help, because then you might realize when stuff starts bubbling up before you're overwhelmed or before you're completely stressed out. So alongside that is just really allowing yourself to do one thing. You can watch TV and not eat and being on your smartphone at the same time. It's about getting to that moment again with TV where you can't wait to see what happens next. And nowadays with Netflix, you can just keep watching more. That feeling you get when you want to watch it, just allow yourself to just watch TV. So many of us are doing 10,000 things at once. Building a support network that can help ease your load. Because yes, there are some people who are never going to be able to accommodate you. And there are some people who are never going to be willing. But there will be people who are, and are willing to learn and are willing to figure it out. And that can be really helpful. The other piece I want to highlight is this idea of, yes, make sure to do stuff that you think is fun and just really brings you joy as often as you can, but also those things that make you feel like, I just did something, I accomplished something. For me, it's laundry. I don't inherently like doing laundry, but there's something so awesome about having all the laundry folded and done and there's nothing in the baskets that makes me feel great. Find your laundry, whatever that is. Also just staying connected. And yes, connected to different communities of other people living with celiac disease, but also some that aren't. And just having whatever it is that really helps you and helps like refill your energy. Because I think about it sometimes as how you're choosing to use your energy. And the gluten-free diet's not going anywhere. So is there room to free up some of that energy in order to move towards the stuff that really matters to you? Now I'll see how I'm doing on time. I think I'm pretty close to done, but I do want to share one really short practice. So this is really an invitation. This is a practice you can actually do in 30 seconds. It can be 30 minutes. You can do eyes closed, eyes open, but really and truly, it's about allowing yourself a moment to stop. Take a breath. even together, just taking a breath all together now. We have lots of ideas in our head, to-do lists, emails, memories, just allowing ourselves a moment to actually feel. Right now in your body, can you feel yourself sitting in a chair? Do you notice parts of your body that might be comfortable or not? Is there something you can do to care for yourself physically? Are there any emotions coming up? And are they trying to tell you something? But also the quality of your mind now. I think noticing if your mind is racing and rushing, if it's a lot of the thoughts, same thoughts, different thoughts, are you all over the place? Just noticing, collecting data. And then once you have all that information, thinking about how you want to move forward. And proceeding, knowing, thinking, okay, how do I take care of myself? Or what kind of a human do I want to be in this moment? How do I want to show up? And using that as something that you can do numerous times throughout the day, just to kind of check in with yourself. And I will repeat it, if kindness and being kind to yourself is hard, that's okay. Aim for curiosity. Thank you, everyone. That is it for me.